Hi, everyone. So I wanted to make a video talking a little bit about licensure, the process, what to expect, and really what do we do after graduation. So often we get that master's degree and we keep our head down and we're so focused on getting to graduation and getting that piece of paper that then it's kind of like, oh, wait, what do I do now? So I wanted to make a video talking a little bit about the licensure process, what's next, what that looks like as far as higher education, if you want to get a PhD versus a DSW. And so I'll talk about a couple different options or different things that students do. Now, obviously, with all things, the caveat is laws change and rules change, and there are some variations from state to state. And so I always encourage students, like, this is a good starting place in this video, but please make sure that you double check your state and your state requirements, because some states like California or New Jersey or Florida do have different rules than others. While things are pretty consistent, there are definitely a few differences or changes between states. So it's always worth double checking your state and your licensing requirements. What's next? Let's say you have graduated and you're coming up into April or May and it's getting close. And so what do you do next? Well, there's a couple options. Ideally, you want to start by getting licensed. So when you get your degree, you're an MSW. Some states will let you practice with an MSW. Many states do want you to have the actual license. It's typically through your state's occupational licensing board. And it's a way for them to make sure that you are, maintaining ethical practice, you are completing your continuing education credits, and that you are following the rules of your state. So the way that you do this is as soon as you graduate with your MSW, or if you want to wait a little while, you can. You typically take a master's licensing exam. And so we'll talk about that in a few minutes and what that process is. You take the exam and then you have your LMSW. While I found that in this field, many of my coworkers have gone on to pursue an LCSW, a licensed clinical social work, licensing through their state. Some do stay with just the LMSW, and there's a lot of reasons for that. When you do a LCSW, or when you try to get your clinical social work license, what happens is you don't get to count every single hour. So when you're doing an internship as part of your MSW, typically if you get there at 9 a.m. and you leave at 5, you count your time. You obviously don't count like your lunch break, but you count the time that you're there. The challenging thing is when you start the clinical supervision process to get your LCSW, sometimes not everything you do will count. You can only count certain hours, certain activities. And so what I found, at least in my state and some states, is some of the jobs that LMSWs do don't always have enough time to meet that clinical requirement. And so I've worked with a number of individuals in, child welfare. I know of people in hospice that just never get to an LCSW. Either they're not able to, they don't have the right hours, or they just don't have a desire. And that's totally okay. A lot of people do stay with their LMSW for a long time. Now, the cool thing is sometimes with LMSWs, just because you don't have a clinical license doesn't mean that you can't get certified in other things. You can take specific trainings, play therapy, or CBT. And so a lot of times people with their LMSW still do trainings. They still build some of those skills. They may not necessarily be part of the clinical supervision process. So if you decide to keep just your LMSW, that's fine. You take a certain number of continuing education credits each year. It changes a little bit. In my state, it literally just changed again. So you're always wanting to make sure you're kind of on top of state requirements, how many hours you should do. Some states require, like, you have to have a certain number of hours in ethics, or you have to have a certain number of hours in suicide assessment. And some states are just a little bit more broad. So you'll want to check your licensing requirements. When you have your LMSW, you typically renew it each year or every other year. Depends a little bit state to state. When you renew it, in my state, they say, hey, did you complete all your continuing ed credits? And I say yes, and I pay my fee to renew. Some states you do have to upload proof of all of them, your different trainings, some don't. It just varies a little bit. So that would be if you maintained your LMSW. What a lot of individuals do, though, is they pursue an LCSW, and that is a great option for a number of reasons. Having your LCSW allows you to practice independently. In a lot of states, that means you can open up a private practice. A lot of nonprofits or might want someone with an LCSW to be the director, so it makes you more marketable. LCSWs typically earn quite a bit more. It varies a little bit, anywhere from 10 to 20,000 more a year. And so a lot of people do end up pursuing it. So the way that you pursue an LCSW is you get your LMSW first. Then you have to start the clinical licensing process. And so it's a little bit different in some states, but what you find is you typically have to apply for it. So you've applied for your LMSW, you take the exam, and now you're an LMSW. Then you have to apply to get your clinical license. Some states, I think, require you to pay up front. Others, you pay at the end once you've done all your hours, but you still have to get approval at the beginning. So you have to find appropriate supervisor. Some states require that you have specialty approved supervisors. Some states are not as restrictive on that. So you'll want to make sure too that if you find really good LCSW to supervise you for your clinical hours, you have to look at your state and make sure they're actually approved. In my state, you cannot be approved for your clinical hours unless the person is an approved supervisor. So being an LCSW is not enough. They have to do further training to be able to get that credential to be able to supervise for clinical hours. So you'll really want to make sure that you don't say, oh, you're an LCSW, you should be fine. Make sure you check your state requirements. So once you've found that individual, sometimes it's on site, sometimes it's a director at your agency. Some people have to contract out. So maybe you don't have an approved supervisor, but you pay them and they meet with you however many hours a week. In my state, you have to have 100 hours of supervision, but that's over 2 years. Stinks to have to pay, but it's okay because it's normally spread out a little bit. Typically, then you have to complete 3,000 hours. Most states do have a requirement. It can't be in less than 2 years. So even if you hit 3,000 hours at 18 months in, you still have to wait the 2 years to be able to then apply for that clinical license. So once you've done the 3,000 hours, and each state does it a little bit differently, but typically they're divided into like a more administrative, that would be writing assessments, treatment plans, that kind of stuff. And then you have the other half of the hours are direct clinical practice. So it's got to be like counseling, clinical sessions, assessments, really that LCSW versus maybe kind of more of a case management type role. In our state, they just passed a rule that you can't do it in more than 5 years. So you have 2 to 5 years to get your hours done. For me personally, I waited a long time to start. I was working part-time, I was having kids, and I knew I was not going to be able to get my 3,000 hours quickly. And so I actually waited till later, and that's fine. I worked as an LMSW for a number of years with no problem finding jobs, no problem making good money. And then once I was in a counseling role where I knew that I was going to have a bunch of hours counting towards that clinical license, I started the process, but it still took me almost 4 years to get it done, just to get all those hours in. Once you've completed the 3,000 hours, then you submit them typically to your state, and your state then gives you permission to take the clinical licensing exam, which is very similar to the master's licensing exam. It's a large number of questions. It does tend to focus a lot more on things like medication, a lot about diagnosis and those kinds of things. So it's definitely a little bit more challenging than the master's exam, but it's something similarly you pay to take it. It's a little pricey. And then once you pass the exam, the state approves you and you get your clinical license, your LCSW. Your LCSW is also renewable. So I renew mine yearly. Some states it's every other year. And I pay a fee every year. And they say, have you done all your requirements? Yes, as far as my continuing education, because as an LCSW, you also have to do that. And a lot of states have rules that when you're an LCSW, the trainings that you take have to be your degree equivalent or higher. So it has to be an LCSW or a PhD that does your CEs for it to count. Not all states are that restrictive. Some are. So definitely also worth checking in with your board. So there are a couple variations. So in some states, if you already have an LSW, let's say that you got your bachelor's degree and you got your license after you got your BSW, and then you go off to get your master's degree. Some states don't require you to do your license for the master's. They say, look, you're already an LSW, you're already licensed, you can start the clinical process as soon as you're graduated. And so you don't necessarily have to do that step of taking the licensed master's exam because you're already a licensed social worker. But if you didn't get licensed after you got your BSW, you're probably gonna have to get licensed as an LMSW. The other thing that students often ask is they say, I want to teach. Awesome. The cool thing is you can adjunct teach with a master's degree. It's an MSW or an LCSW. A lot of schools will require typically you've had like 2 years of postgraduate practice, but you can adjunct teach. And so a lot of social workers teach social work 101 or psychology 101. So if teaching something you're interested in, sometimes students feel like, oh no, you have to go get a doctorate to be able to adjunct teach. You do not. A lot of our field instructors at different universities have their master's degree. There are also some positions, they're called clinical professors, basically, where you don't have to have a doctorate. You can teach with your master's degree, but you can teach at that level. So definitely something to consider. The other nice thing about an LCSW is typically you can bill most insurances. And so you don't need a doctorate. You can go to private practice. You can have your clients. And a lot of my friends right now that are in private practice are making over $100,000 a year. It can be very lucrative. So definitely something to keep in mind. So what's next? Sometimes students will say, I want to pursue another degree. I want to go further. I want to get to the top. And there's definitely some things to consider. We do have two pathways for doctorates in social work. We have PhDs, which is a Doctor of Philosophy, kind of the traditional what we think of. And now we've had this emergent of DSWs, which is a Doctorate of Social Work. And so they're both doctorates. There's a few differences. So I want to talk about the differences because both are expensive. And so these are not programs that I recommend students jump into. You really need to be thoughtful and intentional about the process. Again, I'm not speaking for every program because programs do vary a little bit, but typically or traditionally, a PhD in social work tends to be a little bit more research focused. You do a dissertation or you're publishing, you're doing something research focused so you can become an independent researcher. That's the goal. PhD programs are great. A lot of them have stipends or assistantship options where you can work for the university. You might teach graduate students. You might do some research with another colleague. And so they're able to pay for part or all of your tuition. And a lot of my friends who have their PhD in social work were able to get partial or full payment for their tuition in return for working for the university, which is really nice because doctorates are very expensive. The other thing is PhD programs, not always, but often are in person on a university campus. They include that dissertation, and a lot of times they're preparing you to work in academia. Part of being a professor is doing research. And so it gets you prepared to teach, it gets you prepared to do research and publish and all the things that you need to do. So that's a PhD. Doctorate in social work is something that's kind of emerged more recently. They tend, not always, but they tend to be more practice focused. They're often online, so there's a lot more options for online DSWs than PhDs. I think there are some schools that do an online PhD, but most of the time you'll find an online doctorate in social work is going to be a DSW program, which is great. For me, I was not able to move my family to be able to go pursue my doctorate. So I was really grateful that I was able to stay in my state and go to school in a totally different state online. I had to travel out there a few times a year to do a residency, but ultimately I was still able to maintain my life while getting that doctorate. I have a DSW. And so that's really nice. Now, DSWs are interesting because they are not accredited yet by the Council on Social Work Education. That we have our BSW and MSW programs are accredited. There's some discussion about accrediting them, but for now they're not. And so because of that, there's a lot of flexibility about how DSW programs are structured. Some of them do a dissertation. So although I didn't get a PhD, I picked my DSW program because I knew I wanted to do research. And so I was able to complete a dissertation. Other programs will have you do things like implement, let's say, a program in your community, and then you have to do an evaluation and research how effective it was. Some require you to publish one article before you graduate. So there's a lot of different kind of ways that these programs are structured, but typically involve a component of practice and a component of research, or mostly just practice. The DSW is kind of advertised in that it can help you teach in academia. So I was able to get a job as a full-time professor, which was great. Others use it to run organizations. So they might use it to run a healthcare organization or a large nonprofit. So they really prepare you. And what I found is that DSW programs, because there's a lot of variation, that's something you'd want to ask about if you're interested in pursuing a DSW. Is how is your program structured? What are your requirements? And what are you preparing me for? So typically when you're looking at requirements, doctorate programs, it depends a little bit, but a lot of them do require master's degree in social work and up to 3 years of related postgraduate professional experience. So I've known people who have kind of jumped from bachelor's and master's to PhD or bachelor's and master's to DSW. One of the challenges is a lot of universities now, if you're interested in teaching, do want you to have experience in the field, even if it's 2 or 3 years of practice in the field. And so I've known people that kind of jump from bachelor's and master's to doctorate, but struggle to get a job because they don't have that post-master's degree experience that they needed. So definitely something to be aware of. Even if you find a program that doesn't have a requirement that you could go right from an MSW to a DSW, I really, really encourage people to see, is that practical? Is that going to saddle you with a huge amount of debt and no real job opportunities? The other thing that I didn't mention is that because DSW programs are online, a lot of universities, like state universities, have a requirement that to get a stipend or an assistantship, you have to reside in the state of the university. And so that can make it challenging as well. That's why PhD programs are great because they can often fund you or help with tuition. Some DSW programs do not. So for me, I paid my entire doctorate out of pocket because I didn't live in the state I went to school in, and I was unable to qualify for graduate assistantship. So if you do an online DSW program, that's another thing to ask questions about. Like, is this feasible? Am I going to be able to get some sort of scholarship or assistantship to be able to help fund this expensive degree? So a lot of them have requirements. Some require GRE scores, a lot don't. They typically have letters of recommendation. They might do an interview. You might have to write a paper or an essay to show your writing quality, that kind of thing. So similar to your MSW. The other thing I like to mention is sometimes students think that a DSW or a PhD is the same as a PsyD. So I've had students say like, well, I didn't want to get a PhD in psychology, but I want to be a psychologist. I want to do intelligence testing and competency testing and all these things. There are limits about what a doctorate in social work can do as far as the tests that we can administer. There are some tests that only licensed psychologists, so a PhD in psychology or a PsyD, can administer. So it's important when you're thinking about why do I want to get a doctorate that you're aware of what will your doctorate actually prepare you for, because if you're thinking I'm going to go and I'm going to do all these things, you may not be able to do it even with a doctorate. The other thing to remember is that sometimes if you pursue a doctorate in a different field, so for example, initially I thought about getting my doctorate in industrial organizational psychology. Well, it turns out that I would have had to get a second master's degree in psychology because mine was in social work, and then my PhD in psychology. And so it was going to take 5 years versus my doctorate took 3. It was a 4-year program crammed into 3 years. And so I ended up going with my DSW because I could not afford the time or energy for 5 more years of school. So definitely something to be aware of. The other thing I like to share is that remember, more education does not mean more pay. In some fields, it absolutely does. In our field, not necessarily. The average salary of an LCSW in the United States right now is almost $78,000 a year. The average salary of an assistant professor, which is typically where we start at, is only $71,000. So sometimes if you have a great opportunity or you feel really passionate about research and you really want to go the doctorate route, I say go for it, but be aware that when you come out, your earning capacity may not be $150,000 a year. And if you're having to pay for your doctorate out of pocket, these are very expensive programs. And so definitely something to consider as well. So let's talk about the licensing exam. You got your master's degree, you have your paper in your hand, you walked at graduation. What next? Typically, the ASWB, the Association of Social Work Boards in America, has this exam. And the cool thing is it is a nationally used exam, which means if I live in Wyoming and I want to move to Virginia or Tennessee or Iowa, and I say, hey, I've already taken the licensing exam, I think most, if not all states, will honor that and not make you take the exam again. And maybe a few states that are exceptions, but as a rule, you will not have to take the exam again because it's national. The same test I take in Florida is the same ASWB test I take in Texas, which is the same in Oregon. And so it's nice that it's nationally based. So everybody takes the same type of exam. So there's multiple levels. For some of you, you maybe took the bachelor's level exam after you got your BSW. Some students just skip it and go right into the master's program, which is also totally fine. There's also an advanced generalist exam, although I don't know anybody who's ever taken that. And then there's the clinical exam. So for this, we're going to talk about the master's exam. When you take a bachelor's exam, it's typically focused on kind of that basic generalist practice. The master's exam is a little bit deeper. It looks at the specialized knowledge and advanced practice skills, interventions, medication, complicated family scenarios, those kinds of things. So the exam itself has 170 questions on it. 150 of them are scored. 20 of them are pre-test or pilot testing questions. They do not tell you which are which. You'll just see 170 and you're going to take them all. So you're going to take this test. It's typically multiple choice with 3 or 4 options per question, and you have 4 hours to take the test. They are pretty strict about it. When I went, I couldn't wear jewelry. I had to take off my glasses for them to check and make sure they weren't like Google lenses or anything. They're pretty restrictive. You don't get to bring your phone in. It's definitely a strict testing environment. The nice thing is the website gives you information, so it's not like you just show up and they're like, oh, you're not supposed to have that. They also have lockers a lot of times in testing centers or an area to set your stuff. So definitely you'll want to make sure you read on the website what you should bring, what you're allowed to bring, and what the process is. There's a universal passing score, so you have to get a certain number of questions right to pass. They put the items in random order, so two people sitting next to each other are going to have different questions or same questions in a different order. You can move through the questions and you should be able to flag them and then come back later to them. There are multiple tests as well that are rotated quarterly. It used to be that Pearson VUE was doing the testing. I think now PSI is administering the ASWB test, but that changes, so I would definitely check. And what I found is that most of my students don't have to drive very far. There are hundreds of testing centers across the country, and so for me, I had to drive about 35 minutes. I've had students have to drive an hour, but most of the time, students are able to find one kind of in their area. So again, it's a standardized administration under equal conditions. So you're sitting in a room, kind of a little cubicle area. It's consistent from student to student to student. People aren't going to walk in and sit at a coffee table and do it. It's going to be consistent. They do offer a practice exam online, which is $85 that students will sometimes pay for ahead of time, just so they can prepare themselves. There's also a practice exam through study guides, which we'll talk about, and I'll give you some kind of popular ones that you can do as well. And they recommend that you sit down, you give yourself 4 hours, and you treat it like an actual test, just to give yourself that familiarity. So according to the most recent ASWB exam guidebook, the great thing is the ASWB posts all these details online. So if they change, that's good. You can check it out and be aware of what the changes are. But according to the current edition of the guidebook, you apply for your license in your state and pay the license application fee. So sometimes students go to the ASWB site and they say, I'm so confused. I don't understand. Why won't they let me register for the ASWB tests? Because you have to have a code or an approval email to be able to register for the test. And you have to get that from your licensing board. So you apply for the license in your state through the licensing board, you pay your fee. They say, here's a confirmation email or letter, here's your code. Now you go to the ASWB site. The psiexams.com is the landing page. And so they've got an area you can type in your location and then you schedule your appointment and then you take the test. So apply for your license, get that approval letter, go register and pay for the exam. Then you schedule your appointment time and then you take the test. So the test is broken up into 4 areas or categories of questions. The first is human development, diversity, and behavior in the environment. That's about 27% of the exam. So that's a lot of like Psych 101, developmental psych, Erikson, Piaget, Freud, concepts of abuse and neglect, and then diversity, social economic justice, and oppression. The second section is assessment intervention planning. So these are questions about things like biopsychosocial histories, collateral data, engagement, building rapport, how we would assess different things, those different techniques, and intervention planning, how we might plan for an intervention. Sometimes there's vignettes that'll say, what's the first thing you would do, or how would you address this in a treatment plan? The third section is interventions with clients and client systems. So these are looking at intervention processes and techniques for use across systems, micro, meso, and macro. So you might have questions about how you would address an intervention you might use with an individual or their family or in a group setting, or you might have questions how you looking at things like community organizing or policy advocacy, those kinds of things. And then finally is the fourth area, and that's professional relationships, values, and ethics. So looking at things like confidentiality, that professional development, use of self. There is often questions about things like dual relationships, how would you handle these kinds of scenarios, and that's 25%. So about a quarter for each category. Okay, there are my references. I hope this was helpful for you, and good luck.